So it is Saturday afternoon, and I'm here with Dr. Dan. Dr. Daniel.
I'm here to terrorize you again on Saturday.
I know, this is like our thing. We like to do this on Saturdays, do our live videos for you guys. But we're here today because we want to talk about what routine chiropractic care looks like. And so we're in Dr. Dan's room.
What I standardly do is I'll just scan your spine. I work you from head to toe and make sure everything is in alignment. We use really gentle chiropractic adjusting tools to adjust the vertebrae, and then we work a little bit on soft tissue and fascia using a percussor. And what a percussor is it's a tapping tool, but it feels like a massager. It taps real fast, and what it does is it unwinds fascia, so we can actually work a lot of women who've had scars for C-sections, shoulder surgeries, knee surgeries, have fascia that's wound up, and there's a lot of scar tissue in there. And what percussion does is it taps and unwinds and actually realigns scar tissue. So that helps free up joints and all that kind of stuff. So it's really cool.
All right.
So we work on, like, people come in with shoulder problems, we'll maybe do some active release to the muscles to help work on, full range of motion. So I'll kind of show you some of the chiropractic adjusting tools. We don't want to take too much of your time, but we'll run through, maybe the neck real quick so you can kind of see that. A lot of people are leery of, really aggressive, chiropractic adjustments, which aren't bad in any way, but people are afraid. So I just want to show you that it's really gentle. So,
and it is really gentle, so you can trust
us
on this one.
Using what I call, it's a really big word, it's the adjuster.
Is that a medical term?
And this is an Erconia is the company that we use. So I'm going to actually put on a neck adjusting fork, and we're going to run through here real quick with Catherine. I'm going to pull her hair up, and we're just going to go through and tap those vertebrae in. We're tapping the vertebrae in that have rotated backwards. You're fine. And we're actually working on that lordotic curve in the neck itself. So we're working on straightening out that, or opening up that concave curve. And then because she's sitting there and it's so gentle, it just taps the vertebrae that have rotated backwards in. So then I'm going to put a little tip on, and we're going to see what kind of movement she has in her atlas, which is the first vertebra which holds your head up. So we're going to go through here, and I'm just going to measure the movement. So what we're going to do is I'm just going to ask her to let her head fall with my fingers, and we're testing range of motion. She seems to be gliding pretty well going to the right. And she's kind of stuck on that left side there. So what we're going to do is it's kind of slid to the left, so we're just going to tap that in. So the atlas is located right underneath the ear. And if you want to it's probably better over here.
I got big fancy earrings on today.
And just let your head tilt, and it's just a nice light tap. And you tilt, there you go. Good. So you'll see that'll free that up. So going down to the right, same range of motion, going down to the left. Wow. She gets probably about 10 more degrees. So when you free the atlas up, you free the whole spine up. And there's a lot of chiropractors that just adjust the atlas itself. So we go further than that. But what I'm going to do with her is she has a C5 anterior there. So we're going to go to the front on C5 and tap that in.
Every time. I could probably tell you what they are.
So we go right at C5, and it's you can kind of feel that it's probably a little bit tender. And we just right at C5 and we give it a little tap. And then that's going to free up range of motion and everything and make the neck work better. And then at C6 on the left, she's rotated there too. And a little tap.
And again, that does not hurt. That just feels so good.
So we do that routinely. We'll do a mid-back adjustment with her, and then we'll evaluate the low back and pelvis for restrictions and help move with that. We do some drop adjustments and some more instrument adjusting. The percussor taps real fast, so we'll work on fascial tissue, opening up muscles.
That's fun.
And one of the things I love about coming here, my voice sounds fun right now.
Yep.
But Dr. Dan is so great. If something's bothering you, you tell him.
And we work it in.
And yeah,
Right.
he knows what
I don't
to
know
do.
what wasn't your hand or something
Yeah,
bothering
I
you?
had a
The thumb. So
fingers,
we work for
elbows.
we looked for entrapment sites. We'll look at anywhere that nerve could be blocked from your neck rolling all the way into the thumb. So a lot of times it could be because of a pec entrapment underneath your arm, on the back of the shoulder, in your pronators, into the median nerve. Those are all areas that we look at for the percussor and unwind the fascia in there and open that up. So.
Yeah. But you name
Any
it.
other questions out there?
Type them in the comments. We'll
But
get
yeah,
back.
if you have other questions like another area, do it adjust, how do I adjust that? Just let us know and we'll be glad to run through those areas. But I don't want to sit here and do like a whole thing for a half an hour.
No,
if you
but
guys
I'm
don't want
telling
to
you,
see it.
anything you're like, oh, maybe I should go to my doctor for. Yeah. come to this
Musculoskeletally.
doctor.
We can at least, you can come in and I can talk to you and we can evaluate it.
Yeah.
And if it's something that I can't help you with, then we'll send you to someone else. But routinely, I say stay as conservative as possible, with treatment. And then if we can't help you, we'll send you to the next level. So, okay?
Alrighty. See you guys next Saturday.
Bye.
I'm sure you were totally tickling me.